Hello, everyone. My name is Jessica Martinez, and I am the president of Razzie Hospital. Our hospital is the only hospital within a 45-mile radius. We have many rural areas that utilize our facility, and it is extremely important that our staff screen individuals to help eliminate this outbreak and contain those that are infected. We will educate our staff so they are aware of pertussis, which is otherwise known as whooping cough, and also the symptoms that come with it. Whooping cough is caused by the Bordetella pertussis bacteria. It is highly contagious and passed through air droplets from infected coughs or sneezes. This can be prevented, however, with proper immunization and proper hygiene. Our staff will evaluate patients who present themselves or those who call our hospital. We will have an office where we will screen and a contained area in our hospital to treat those in need. We will check for mild symptoms and symptoms that are severe. The mild symptoms would include runny nose, nasal congestion, red watery eyes, low-grade fever, and a cough, whereas the severe symptoms would include uncontrollable fever, vomiting, decreased fluid intake, blue lips and skin, and difficulty breathing. Verification of proper immunizations will be done by our staff to see if they have received the 5 doses of DTaP. These are usually given to children 2 months of age through 6 years of age. Booster vaccines are then recommended every 10 years thereafter. Proper hand hygiene would include cover your mouth and nose with a tissue when you sneeze or cough. Put your used tissue in a wastebasket. If there is no tissue available, it is a good idea to cough or sneeze into your upper sleeve or elbow, not in your hands. Washing your hands immediately after with soap and water for at least 20 seconds. And if water and soap are not available, you can use an alcohol-based hand rub. Because we have limited space, we will determine if a patient can be treated at home or if they require hospitalization. Hospitalization may be required if the patient has a fever of 101 through 102 degree Fahrenheit that cannot be controlled with Tylenol, dehydration because of the excessive vomiting and decrease in fluid intake may require IV therapy. And if they have blue lips and skin due to difficulty breathing, oxygen may be needed. Symptoms that can be treated at home are the mild ones: fever that can be reduced with Tylenol, a mild cough, and runny nose. Once a patient presents positive for whooping cough, we will determine if the patient needs hospitalization or if they can be treated at home. We will gather information for all of those who the patient came in contact with, and our staff will notify those that did come in contact with the patient to screen to see if they do need immunizations or antibiotics. We will provide resources, assistance for free immunization, also assistance with government insurance paperwork and educational resources. We will then report the demographic information to the CDC. For those who do and are hospitalized, visitors will be limited. They will not be able to visit any of the patients who are in that department unless they can show documentation that they have completed the vaccination series. Visitors will be required to wash their hands before entering the room and after leaving the room. And infants and pregnant women are not allowed at all in the room because they are at greater risk for infection. Our website will provide educational information regarding the whooping cough, and we will also distribute flyers to schools, daycares, and businesses to bring awareness to this epidemic. We have partnerships and alliances. Hospital staff will assist the patient with applying for insurance coverage. We have established a hotline where we can assist patients with education about the disease and the risk of not being vaccinated. And for those who are uninsured or underinsured, there is the Vaccines for Children program that we can try to see if they are eligible for and also provide other community resources. In conclusion, Rassie Hospital is the only hospital in our county. We serve a large population with lots of rural communities. We will monitor patients and visitors to contain this infection. Aside from treating the disease, education regarding immunization and proper hygiene are huge factors in eliminating this outbreak. Community resources are limited, and we will have to reach out to state and government programs to help our patient population. Our staff members will assist the patient and families in care and resources to ensure patient satisfaction and disease prevention. Together, we will work to treat, prevent, and eliminate this outbreak.